Adopting a vegetarian diet is essential for kidney health. Why vegetarian diet is important is it creates a positive impact on the gut health by reducing the harmful uremic toxins by resetting the gut imbalance. Thereby, the harmful bacteria are reduced and the good bacteria are promoted by a vegetarian diet. Sulforaphane is very rich in vegetables like broccoli, cabbage, cauliflower, and kale. These compounds are associated with good kidney health and also heart health. Not only that, these reduces the harmful toxins which are generated day to day in our gut. The high fiber, which is only seen in vegetarian diet, is very important not only in improving the intestinal motility but also by promoting the overall gut health. And high fiber diet by itself can improve your kidneys. The acid normally is generated when we eat rice, roti, wheat, and non-vegetarian dishes. But when we eat vegetarian diet, the acid is neutralized by the base or alkali that is normally produced. So vegetarian diet reduces metabolic acid that is generated in the body in kidney patients. And low phosphorus diet is important because high phosphorus in the blood increases heart diseases, and it's a very strong risk factor for heart related problems. And a vegetarian diet reduces phosphorus level naturally. Also, vegetarian diet is a good source for magnesium and vitamin K, which are very essential for kidney patients. These are not easily available from an animal diet. Vegetarian diet neutralizes the oxidative stress and inflammation that day to day our body produces during normal activity. And in people with kidney disease, this oxidative stress is enhanced, and taking a vegetarian diet naturally balances and cures this problem. High potassium is a major concern why vegetarian diet is not very popularly given by the dietitian and many doctors, especially kidney doctors for kidney patients. But however, if we are able to understand and reduce this problem, we can easily adopt vegetarian diet for any patient. In a later video, we'll exactly tell you what are the different kinds of cooking methods which helps us to reduce the potassium. However, if your potassium is very low, especially if it's less than 4, you can happily take all the vegetarian diet without any problem. And as long as it is reduced to less than 5 milligrams per liter in your blood, you can safely take most of the vegetables. Constipation is a very important correctable problem which not only makes you feel good but also reduces the toxin that is normally generated, and also helps to keep the potassium in your blood under check. Dal, pulses, there is a lot of confusion about whether to take or not to take in kidney patient, but trust me, this is a superfood and it's extremely useful to control and improve your kidney function. The potassium, which is very high in dal pulses, can be easily reduced by just keeping and soaking them in water for 2 hours before you cook. So drain this water and then refill with new water before you cook. Soda soft drinks are consistently shown to be very bad for kidneys and also for heart and brain, and try to avoid them if you want to protect your kidneys. Constipation, as we discussed, is very easy method of eliminating the toxin from the body. It reduces the potassium and it can be easily managed by a vegetarian diet. Soya products and legumes, there's a lot of misinformation about soya products which comes in forms like tofu, soya milk, soya cheese, soya yogurt, and these are very beneficial in early kidney stages where protein restriction is lesser a problem, and but they also give an added benefit of heart disease prevention, reducing the bad cholesterol, and also helps in phosphorus control. So the beans, soya beans, other beans, by being high in fiber and complex carbohydrate and low in fat, makes them a very good addition to kidney friendly diet. So regarding pasta noodles, who is interested in, try to choose whole grain pasta and noodles, especially spaghetti and rice noodles, especially if you do not have diabetes. Having nuts, especially unsalted, almonds, cashew, walnuts, fewer hormones, they are nutrient rich, providing protein, fiber, omega-3 fatty acids, and they are safe in kidney patients. The spices like what we normally use are extremely safe. There's some miscommunication because some of them do contain potassium, but anyway, remember we only take very little amount of all the spices, making them very safe in kidney patients. Regarding cooking oil, the one we commonly use is groundnut oil, very safe, and they can tolerate very high heating, followed by virgin olive oil, safflower oil, sesame oil, and to some extent sunflower oil. So they are very useful for high heat cooking, and they are all of these are safe in kidney patients. Other spices or condiments that we should use and explore, because these helps to improve the flavor of the food, which are compromised by a reduced salt intake in this food. So lemon juice, small amount black pepper, and other salt-free seasoning, which we're going to see in the next slide, are very useful. And also don't forget that you can use hot sauce from chilies, which is readily available, or you can make at home as salt substitutes. So they help you to control the salt intake and also enjoy the flavor of the food. So tea and coffee consumptions should be restricted because both tea and coffee contain, especially the milk coffee, contain potassium and phosphorus. So as long as your phosphorus is less than 4 and your potassium is well controlled and less than 5 consistently, you can take 1 cup per day, or if you enjoy 2 cups, take half cup 2 times a day. But if your potassium and phosphorus are uncontrolled, you should control or restrict coffee and tea consumption till your targets are reached. Sugar substitutes, artificial sweeteners are increasingly popular for patients with diabetes for sugar control, but they come with lots of controversies, and definitely I would not recommend for people with kidney disease, because not only it worsens the kidney problems but also increases heart disease risk and also malignancy and cancer risk. So next time you want to use a sugar substitute, be aware that they are not safe and good, and in fact it can even increase your weight, because you tend to think that it doesn't contain sugar, you may tend to overeat. And so overall, if you see, the benefits are very low, the risks are considering the benefit are very high. The serum phosphorus, next to that is serum bicarb and phosphorus levels you need to watch out, and these are naturally favorably controlled in vegetarian diet. So on a sick day, especially when you have fever, diarrhea, vomiting, try to avoid the medicines the doctor tells you. There are some, not all medicine needs to be stopped, but some of the medicine definitely should be stopped on these days so that your kidneys do not get damaged. Water intake, you can safely drink 1.5 to 2.5 liters per day. On a hot day, maybe 2.5, on a cold day, around 1.5. But also you remember that the food that you eat, the rice what you eat, get cooked in water, and they also have a lot of hidden water. So try to drink less so that total overall water intake, including all what you drink and eat, should be less than 2.5 liter per day. Milk, because is not very safe in kidney patients because it increases the phosphorus level. Try to reduce it to 100 mg per day, and if your phosphorus goes to more than 4.5 milligram per deciliter, try to reduce even further. So home-based blood pressure monitoring is the gold standard for BP measurement, and not the blood pressure what the doctor checks at in the clinic or in the hospital. So the average blood pressure should be around 125/75 at home. The blood pressure tends to be slightly low in the morning and high in the late evenings and night. And try to use a digital BP machine. These machines are very advanced these days. They are as good as the machines the doctors use at hospital. So when you have advanced kidney damage, trying to strictly control the blood sugar to very low levels, say like less than 80 before food and less than 160 after food, is safe in young people and people with early kidney disease. But in advanced age and also in advanced kidney damage, trying for an aggressive blood sugar control comes with lots of low blood sugar episodes, which is much more dangerous than have a loose blood sugar control of 180 to 250 after food and 90 to 130 before food. Eggs can be consumed by kidney patient, but try to restrict to not more than one per day. And if you're eating more than one for any reason, try to eat only one yellow part of the egg per day. So the the salt intake, there is a lot of confusion. The gold standard way of knowing what you are really taking is to do a 24-hour urine collection and check how much sodium you are passing per day. Normally, if you pass 100 milligrammes sodium per day, it means you're eating 6 grams of salt per day. And most of our assessment, including yourself, you tend to underestimate your salt intake. The recommended salt intake is 5 to 7 gram, yet you must be actually taking around 10 grams per day. So to reduce salt intake, try to do it like 5% to 10% per month, because suddenly drastically reducing salt intake is very unacceptable for most people. And not only that, it is body cannot adjust to sudden changes in salt intake. So try to achieve a 30% reduction in salt intake over 3 to 6 months. And oil-based herbs and chutney helps you to reduce your salt intake because it enhances the flavor. So you can use pepper, chili flakes, and various other spices. And you can also try putting all these spices, whichever you want to, chutney or spices in 30 minutes, and then use that as along with food whenever you feel there is low salt and the taste is not good. So this way, what happens is you get the good things from these spices, and you avoid the bad salt of bad thing of eating too much of salt. And you can increase more spices and masala in your cooking, like garlic, curry leaves, corianders, and other spices, and enhance the taste, flavor, and tend and reduce the need for adding more salt. So there are a lot of other ways of having add-ons on the dining table, because a lot of patients, a lot of people want to add extra when they eat, and they always complain and fight. So to avoid this problem, you keep chili flakes, lemon, onion, nutritional yeast, rosemary oil, ground pepper, all except the salt in the table. So they can experiment what they like and what they want to blend and discover their own personal favorite. If you have consistent leg swelling and you are not able to manage, the doctor is struggling because the medicines are not working fully, so check that there must be some mistakes you must be doing. First and foremost is check whether you are taking the salt correctly. So you can do a 24-hour urine collection and then check how much sodium there is there in the urine. And if you're passing more than 100 milligrammes of sodium per day, it means you're taking, control your salt. And also be aware that eating outside food always come at a cost. So they are more tasty sometimes you feel, because they add more salt, and more salt, if you eat it, it's impossible to eliminate the leg swelling, and you need more medicine to control your leg swelling. So try to avoid it. And avoid pickles, salted puppet, because they also have lots of salt. And limit eating food outside, because each time you eat outside, you're eating not only food outside but also excessive salt. So watch what you eat, and it can change your destiny and also your kidney health significantly.